10% order set is going to be found on sasblood.ca/programs/sask-IVIG-program. A lot of people go to SAS Blood or they accidentally go to blood.ca, but you have to make sure you go to SAS Blood to find our order sets. Steph and I are going to record a video for nursing so they can know the new process. We have not had a chance to do that yet, but we will be on this SAS Blood website under the video section. So here's what our order set looks like. So this is page 1 of our pediatric order set. If you want to click stuff, there we go. This is where you're going to find your name and date here. Name, date of birth, sorry, and HSN number for the patient. The first part is practitioner information. So this is pretty simple. The physician should fill it out themselves. Up next, we have IVIG request. So this will indicate if it's an inpatient or an outpatient request, and anticipated treatment start date can be found on this form. It'll also indicate if it's an initial request or renewal request. Ooh, that R sounds hard today for me. So patient clinical information is next, and this is where you're going to get your diagnosis from our criteria for clinical use of immune globulin 2nd edition, which was produced in February 2022. And that's the document that we screen all of our information from. Page 2 of the order set starts out with the initial orders, tells you if they have had any previously indicated treatment instead of IVIG. If this part is not filled out, that is not necessarily a big deal because that's mostly for us for our screening purposes. On to the next part is lab testing and investigations. Just for your information, an ABO group and screen is required prior to initial treatment. If a physician checks off any of the other boxes, they are responsible for providing the requisition for the patient. Up next is our IVIG dose calculation using dosing weight. So in blue here, we have the link to the adjusted body weight calculator. We also have a QR code in the corner, so we're really hoping that that does not get missed for people. When you click on either one of those, this is what the calculator looks like. You enter in the height and weight, and then you calculate it, and it gives you the ideal body weight and then a dosing weight. And then over here, you can calculate the IVIG dose if you want to do 1 gram per kilogram, or if it goes down to 0.4 or even 2 grams. So however you want to enter that in, you can get that information. Because we're talking about pediatrics, their height and weight might not meet the criteria for the calculator. So we'll talk about that on the next slide. So next on this POS page is the IVIG dose and frequency. So this is where you're going to enter in your weight and your height of the patient, and the dose will go here. On to the next slide. Thank you. Adjusted body weight for pediatrics. So because pediatrics will not necessarily meet the criteria, we are going to go by any patient under the age of 10 will always be dosed on actual body weight. Once a patient reaches the age of 10, they must meet both the height and weight criteria for the adjusted body weight calculator. So the height for the calculator is 152.4 centimeters, and the weight is 20 kilograms. So if a patient is over the age of 10 but does not meet these requirements, we're going to continue to use the actual body weight. So we thought it would just be simpler to have an age limit. So 10 and under, body weight. 10 and over, check to see if they meet the criteria. You may notice on the pediatric order set that there's a line that states adjusted body weight. If adjusted body weight is required, provide body mass index. This will not affect dosing and is placed in there to aid the physicians in flagging if a patient is overweight or obese in pediatrics, because that increases their risk factors for other health conditions. On to page 3 and 4. Page 3 begins with IVIG dose. So this is where the physician will check off if it's an induction, which is a one-time dose, or a maintenance dose. And the maintenance dose is also again in grams per kilogram, and it can be divided over a certain number of days, and then it'll be repeated however many weeks for however many cycles. Maximum months is 6 months. Cannot expand that 6 months. IV fluid subs up next, and this is just if the physician wants to have any medications prior to the IVIG infusion. Free medications are only actually given if a patient has had a previous reaction to IVIG. You'll notice that medications continue onto page 4, And the medications on page 4 are the ones for if the patient starts to have a reaction. So these would be your PRN medications if there's any kind of issue with the IVIG infusion. The last box on this page is probably the one we want to highlight the most. It's the IG Stewardship Program TML. TML stands for Transfusion Medicine Lab Screening and Approval box. So you will notice it looks very similar to the adult one. On the adult box is page 3, and on the pediatric, it's on page 4. So the first thing you're going to look for is that the dose has been verified. If the dose has been adjusted, it'll be flagged here for you. We want to look to make sure that the dose is approved. And sometimes we approve them only for 3 months because we want to have clinical proof that the IVIG is working for the patient, or there may be another reason that the physician only wants it for 3 months. And that physician would be the transfusion medicine physician on call, not us. Up next is the technologist's name. So if this is an inpatient order set, the technologist is the one who's going to sign and approve it. And if it's an IG nurse navigator is the next box, and that will be either my Stephanie or myself where we've approved it and sent it off. Up next is page 5, which is just the infusion table. Thankfully, there's not information that needs to be filled out for the physician here. So if your pump is ever malfunctioning and not working, you can always look at this table as a guide to help you on how to run fast to run your IVIG infusion. Up next, we created an inpatient pediatric 10% IVIG POS process map. So the inpatient process map does differ from the outpatient process map. Our contact information is on the top in black up here. It just basically leads you through the whole process. If you have any questions or concerns at any time when you're looking at an order set as an inpatient, you can definitely reach out and contact us and we can try and help troubleshoot. The outpatient pediatric 10% IVIG process map looks quite similar. However, there's lots of different steps. Also, once again, our contact information is on the top, so if you need any help, don't ever hesitate to reach out. We're always here to answer questions or look things up if we don't know. Up next is patient education. So there's multiple educational materials on sasblood.ca. There's specific adult and pediatric IVIG information. There's a section for IVIG frequently asked questions, adult and pediatric information for families. There's also information on sub-Q IG. And in the future, once we have our process map out, the IVIG infusion patient logbook and IG therapy options will be required to give to patients. I think that wraps up our presentation. If anybody has any questions, feel free to enter them in the chat. And let me just peek. I think I see some typing here. Oh, how do I get over there?
Hi, girls.